Hello friends, let us now learn about the Gitelmann syndrome. Gitelmann syndrome mainly occurs in the distal convoluted tubule. So this is the distal convoluted tubule. Whenever there is a mutation in the sodium chloride cotransporter present in the apical membrane of the apical membrane of the distal convoluted tubule results in this Gitelmann syndrome. See, Gitelmann syndrome, there is a mutation in thiazide sensitive sodium chloride cotransporter. So this will help in reabsorption of sodium and chloride. Normally, sodium chloride cotransporter helps in reabsorption of sodium and chloride. But if there is a defect in this sodium chloride cotransporter, this results in Gitelmann syndrome. So here there is no reabsorption of sodium and chloride. So sodium chloride is excreted, and there is also magnesium which is excreted. But the loss of excretion of magnesium, the reason is not known. We do not know why the magnesium ion is excreted. But here, because of excretion of magnesium ion, there is severe hypomagnesemia is seen in the patients. Then there is this sodium and chloride excretion will result in, along with this, even the water gets excreted along with this sodium chloride and magnesium. This excretion of water, sodium and chloride and magnesium results in hypovolemia. Because of this hypovolemia, this will be sensed by macula densa and renin-angiotensin aldosterone system is activated. Because of this activation of renin-angiotensin aldosterone system, there is increased absorption of sodium in the collecting duct. Because of this renin-angiotensin aldosterone system, there is increased absorption of sodium in the collecting duct. Whenever there is absorption of sodium in the collecting duct, there is excretion or secretion of potassium and by H plus ions. So because H plus ions are secreted, this will result in metabolic alkalosis. So even if you do not remember this whole pathway, it's fine. But in Gitelmann syndrome and in Bartter syndrome also, you see presence of metabolic alkalosis. And in Gitelmann syndrome, there is severe hypomagnesemia, and there is one more thing, that is hypercalcemia is seen. There is increased calcium levels are seen in the Gitelmann syndrome in the blood. So treatment of Gitelmann syndrome is simple. You will have to supplement calcium, not calcium, because calcium is already high. You should not supplement calcium. In Gitelmann syndrome, you should supplement magnesium, sodium and chloride should be supplemented. Right? So this is about the Gitelmann syndrome. Thank you for watching my lecture. Thank you.